Hi, my name is Dr. Peter Leininger. I'm a professor at the University of Scranton, Pennsylvania. We conducted a systematic review on dry needling with TMJ dysfunction, and the students they did a systematic review and came out with 4 articles that they surmised on the conclusions with that for TMJ dysfunction, and 3 of the 4 looked at the masseter putting the needle into the trigger point. 1 looked at the lateral pterygoid, and the results were positive for each of them. There were differences how often they did that. Most of them were once a week, but this was once a week for 3 weeks, once a week for 2 weeks, 5 weeks, and also for 3 weeks. Most of them went into the trigger point. They tried to elicit a twitch response. Some would do it 1 twitch response and then go back. 1 also compared it with control medication. 1 also used electrical stimulation with that. They all had positive results to increase the range of motion of the jaw opening and also decrease pain following the trigger point treatment. The conclusion that we had here, it's effective treatment. More studies need to be done looking at a larger population with that, and also to determine the most ideal treatment. How many treatments are ideal to have the best benefits with that. Also, the techniques, some were altered on what they did using the trigger point, but almost all of them would get a twitch response with the trigger point, and they would palpate the trigger point before and after the treatment with that. So it's showing more and more in our country, and I'm sure in Canada they're using dry needling for more intervention, and this study shows preliminary that it's effective with TMJ dysfunction. Thank you.